let's see if anyone can see the flag. We'll stand in the Pledge of Allegiance and a moment of silence, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ladies and gentlemen, I apologize. I am on Zoom meetings 5 times a week, and I never have a problem like I have with these Zoom meetings. On the first item on the agenda is the consent agenda. Communications, correspondence, homeschool requests, approval of minutes, June 9th and June 23rd, school committee meetings, June 30th, special school committee meeting, June 8th and June 22nd, building committee meetings. Is there any discussion?
Through the chair, I just need to let you know that I need to recuse myself on the consent agenda number 3. And I will be forwarding the paperwork to Cheryl or to Sharon.
For all items?
No, just number 3, which is the homeschool requests.
Okay. Any other comments?
Move to approve.
Is there a second?
I'll second it.
All in favor, please signify by saying aye.
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 Any opposed? I know this is a little early in the meeting, but
He's gone.
agenda item. One of the primary agenda items is the reentry task force. And I know there are questions about the reentry task force, but are there any public comments? Has anyone requested a public comment at this point?
Yes, there are public comments. I'm going to put them up on the screen, and I'm going to work with Sharon to put them up. Just bear with us a minute while we get them set up.
Okay, the first public comment is up. Sharon, do you want to read it? This is a long comment. I did get a copy of this, and I believe this went also to the commissioner as well as the governor. I'm not sure it was this one or another one from Mrs. Muse. I did answer her. So I'm just going to let you know that.
Would you like me to read it?
Yeah, so everybody can see. Or
okay, Ben, can I go a little larger?
Do you want Sharon to read it?
Yep, I'm going to make it a little larger for you.
Thank
Sharon.
you, Ben.
No problem.
Okay, thanks, Ben. The first comment is from Stephanie Muse. I am reaching out to you in regard to the state's 2020-21 school reopening plan. As I am sure you are aware, with draft plans for reopening due on Friday, there are heated debates now happening in every forum, Zoom meeting, text message, and Facebook group across the state. Under national pressure from President Trump and Secretary DeVos to reopen schools and return to business as usual, your leadership and collective strategic state action is required. We must make distance learning the fall reopening plan for all districts. Making this decision as early as possible gives schools more time to increase the efficacy of distance learning. It is highly likely that we return to distance learning at some point next school year, freeing ourselves of the burden of planning and implementing an expensive in-person reopening will allow districts to instead focus on
Yeah,
and invest
I
in
know.
making distance learning the best it can be.
What? Wait a minute.
Can everybody mute, please? Thank you. Go ahead.
We need to create a phased reopening plan in which districts with the fewest cases using the safest and most extreme protocols reopen first, followed by face-to-face instruction in less funded, harder hit communities where the consequences of school transmission are likely to be more severe and happen more quickly. I strongly suggest a fall plan that has all Rhode Island schools returning to virtual learning with the goal of beginning a phased reopening after winter recesses. Given that many experts are hopeful that a vaccine or treatment will be available in early 2021, the most cautious approach is to stay the course with remote learning for the first semester, then revisit reopening. In the interim, medical science will continue to learn more about the virus. Officials will continue to prepare personnel and facilities for reopening, and states and municipalities will hopefully implement temporary programs to mitigate the negative effects the closure will have on disadvantaged families, those who rely on the school system for supervision, for example. Ben? I think it continues.
Yep, this continues.
Please. We need to prioritize supporting the health, safety, and learning of our most vulnerable families and students. Instead of spending the next 6 weeks figuring out how to get all children back to school safety, we need to create solutions that respond to actual needs. If families must return to work, how can we use our school buildings as spaces for supervised virtual learning? If families can be home with students, how can we ensure equitable access to the tools necessary for virtual learning? Devices, high-speed internet, headphones, books, notebooks, and pencils. We must require students and staff returning to school buildings to wear face coverings and maintain the CDC recommended social distance of 6 feet. We must require that schools have updated ventilation systems in place, if not air sanitizing systems. Recently, 239 scientists published an open letter urging colleagues and policymakers like the World Health Organization to acknowledge that CoV-2 can be transmitted through airborne microdroplets. This means that close contact measures such as distancing and partitions cannot prevent airborne exposure, especially in indoor environments. According to the letter's authors, specialized ventilation and air sanitizing systems would be necessary to prevent airborne transmission. Additionally, we must acknowledge that a closed pod of 30 students, as called for in draft plans, is not truly a closed pod when those students then ride the bus, attend after-school programs, play on sports teams, and have dinner with their family members. A closed pod sounds great on paper, but lulls families and teachers into thinking the risk of contracting or spreading the virus has been diminished. Families trust their school leaders. We cannot mislead them into thinking it is safe to send children to school in the fall. Proponents of school reopening are quick to cite studies suggesting that children do not contract or transmit the virus as readily as adults and that they are spared its worst effects. In truth, these studies are not conclusive, and scientists have admitted that we don't know what will happen if thousands of children are suddenly thrust into poorly ventilated buildings with hundreds of adults. In discussing ongoing studies on children's ability to transmit the virus to those around them, Dr. Anthony Fauci, director of the National Institute for Allergy and Infectious Diseases, said, "We don't really know exactly what the efficiency of spread is among children. What's more, the virus' direct effect on children is also poorly understood. Early research suggests CoV-2 kills fewer children, but we know relatively little about the long-term effects. More alarmingly, a leaked internal memo from the Centers of Disease Control admitted that reopening schools remained, as of July 8th, the highest risk for spreading the coronavirus." In the midst of a global pandemic, our focus must be on the health and safety of all residents. A statewide return to face-to-face instruction in the fall will disproportionately affect the students in Rhode Island's most vulnerable school districts. When these students return to school, they will have less access to health care when exposed or infected, and their parents will have less ability to keep them home when they have symptoms. More importantly, there is greater likelihood that these underprivileged students will be exposed at school because their districts will not be able to afford the safety measures voluntarily adopted by districts with more resources. If the more privileged districts return to in-person learning before their less privileged counterparts, our most vulnerable students will fall farther behind their peers, and we will have created an equity nightmare. This decision cannot be put off until August. Schools need this precious time to focus on improving the quality of virtual learning for the upcoming school year. Please protect our students, teachers, and the community at large by opposing school reopening for the first half of 2020-21, not only for East Providence, but for using your voice and position of power to encourage your peers and leaders to take unilateral action. I hope we can depend on you to keep Rhode Island students safe this fall. And the next one, public comment, is from Peter Muse. East Providence School Committee members, I urge you to push for 100% virtual school reopening of schools in August. At the very least, you need to do due diligence in collecting feedback from and presenting a transparent draft at every step of the way to family and community members who will be impacted. It is inarguably that Rhode Island will likely need to return to virtual schooling at some point this school year. We should be spending this time and money making virtual learning the best it can be, not spending hours and hundreds of thousands of dollars planning to have students and teachers in the building for part of the day and in less than ideal learning environments. Okay, one more from Christine and George Gagnon. You
Wait a
must,
minute.
excuse
Does
me.
Can I just make an overall comment that it is not our choice as far as opening schools? It is the governor who has stated that schools will reopen on August 31st. So I just want to make that clear to everyone. It's not my choice. It's not your choice. It's no school committee's choice, no superintendent's choice. Right now, that is what the governor, and if you listen to her press conferences, that's what she's saying. Okay, Sharon?
Okay, I'll read this one from Christine and George Gagnon. You must make distance learning the default reopening plan for our district and encourage districts statewide to return to virtual learning in the fall. Making this decision as early as possible gives schools time to organize and educate in order to increase the efficacy of distance learning. It is an indisputable fact that we will likely return to distance learning at some point next school year. Lifting the burden of using our capacities and budgets to plan for an expensive in-person return will allow districts to instead focus on and invest in making distance learning the best it can be. We need to create a phased reopening plan for schools, opening schools and districts with the fewest cases, using the safest and most extreme protocols first, before rolling out face-to-face returns in less funded, harder hit communities where the consequences are likely to be more severe and happen more quickly. I strongly suggest a fall plan that has 100% of Rhode Island schools returning to 100% virtual learning, with the goal of beginning a phased reopening after winter recesses. We need to prioritize supporting the health, safety, and learning of our most vulnerable families and students. Instead of spending the next 6 weeks figuring out how to get all children back to school safely, we need to invent solutions that respond to actual needs. If families must return to work, how can we use our school buildings as spaces for supervised virtual learning? If families can be home with students, how can we ensure equitable access to the tools necessary for virtual learning? Devices, high-speed internet, headphones, books, notebooks, pencils. Continue. And lastly, whether we return to school in fall virtually or in person, you must call a moratorium on broadcasts for, at the very least, the 2020-2021 academic school year. You must require any students and staff returning to school buildings to wear face masks and socially distance. A closed pod of 30 students, as called for in draft plans, is not truly a closed pod with those students. Then ride the bus, attend after school, play on sports teams, and have dinner with their family members. A closed pod sounds great on paper, but lulls families and teachers into thinking the risk of contracting or spreading the virus has been diminished. Families trust their school leaders. We cannot mislead them into thinking it is safe to send children to school in the fall. In the midst, excuse me, of a global pandemic, our focus must be on the health and safety of all residents. Any decision to return to schools face-to-face in the fall anywhere in the state will disproportionately affect our students in Rhode Island's most vulnerable school districts. They will either return to school and suffer less access to health care when exposed or infected, less ability for parents to keep students home when they have symptoms, increased likelihood of exposure in districts that can't afford the same safety precautions as better funded districts can. If some of our state returns to in-person learning before the rest of the state is ready, our most vulnerable communities will suffer as their peers in wealthier districts, less impacted by coronavirus, reap the educational benefits of being able to return to school. This decision cannot be put off until September. Schools need this precious time to turn focus toward quality virtual learning for the upcoming school year. Please consider the data, consider the children, consider teachers, consider families, and change tune about reopening schools August 31st. I believe that's the end.
Last one.
Okay, this is from Holly Farias. We must require all students and staff returning to school buildings to wear face coverings and maintain the CDC recommended social distance of 6 feet. We must require that schools have updated ventilation systems in place, if not air sanitizing systems. Recently, 239 scientists published an open letter urging colleagues and policymakers like the World Health Organization to acknowledge that CoV-2 can be transmitted through airborne microdroplets. This means that close contact measures such as distancing and partitions cannot prevent airborne exposure, especially in indoor environments. According to the letter's authors, specialized ventilation and air sanitizing systems would be necessary to prevent airborne transmission. Additionally, we must acknowledge that a closed pod of 30 students, as called for in draft plans, is not truly a closed pod when those students then ride the bus, attend after-school programs, play on sports teams, and have dinner with their family members. A closed pod sounds great on paper, but lulls families and teachers into thinking the risk of contracting or spreading the virus has been diminished. Families trust their school leaders. We cannot mislead them into thinking it is safe to send children to school in the fall. Distance learning should be an option for parents not willing to risk their children's health and the health of people in their lives. Okay.
And that's it.
Okay, thank you.
Mr. Jonas?
I hear you. You're breaking it. The meeting goes on and off. You want to start your superintendent's report, Superintendent?
Absolutely. We are going to begin our report with a re-entry task force update for you. This task force, as I mentioned at the last school committee meeting, has worked very, very hard to write to write 3 different plans for the Rhode Island Department of Education, which is required of every school system in the state of Rhode Island. This team has put in hours and hours of work into this draft report. Now, even what we tell you this evening, the next time I talk to you could be different, because every day something is coming out and could change the plans. We did submit our draft plan on Monday. There is supposed to be a 72-hour turnaround in that plan to come back to us to make any types of suggested revisions for us. And then once that happens, we expect to publicly go out and speak with all of our staff and also our parents and school committee with what the actual plan is for East Providence. The Department of Health is spearheading this whole process for Rhode Island. So I'm going to turn this over to Dr. Sandra Ferran now. Sandy?
Thank you. So the superintendent gave you a lot of the background information. I just wanted to go over that quickly again. There were 4 separate committees that we worked with: physical environment and safety, teaching and learning, business and operations, and social emotional learning. And the chairs of those committees are all here tonight to give a high-level update of what they've been working on with their committees. As the superintendent said, the plan was last Tuesday and put together with input from all of the committees. We had 60 members of different stakeholder groups that contributed to the plan. It was Tuesday night, it was given to the task force. The task force had 2 days to review it, and on Friday, we reviewed the whole plan with the task force, made some changes over the weekend, and submitted it to RIDE on Monday, and we hopefully will have it back on Thursday. So as the superintendent said, it has to meet RIDE and the Rhode Island Department of Health criteria with the 3 options for full opening, partial opening, and distance learning. First and foremost, all of these committees looked at safety. The decisions that we made were all based on the evidence that we had, the research that we did, and the safety of our students and staff, and how we could accomplish that in these 3 separate plans. The district model that was submitted on Monday is somewhat of a hybrid plan. So right now, with a full reopening, we would plan to bring all elementary in, and middle and high school, as of right now, in the plan that was submitted, would be somewhat of a hybrid model, because we don't feel right now that we could bring all of those students back into the same building safely and continue to social distance, and have them move through the hallways as needed in a safe manner. So the middle and high school is looking at a hybrid plan right now, and we're waiting for feedback on that plan. We are also exploring ways to provide a distance learning option for families of students that cannot return to school for some reason. So the district is also concentrating on that. That is a work in progress right now. And in addition, we are focused on the other options, the full distance learning. We are working on revising our spring plans and addressing some of the issues that were actually brought up in the public comment, making sure we have access to technology for all students, making sure that we're providing rigorous instruction to all students, and that we're getting that face-to-face time and that social emotional learning needs addressed in distance learning also. So we are working on all of these options at the same time. You know, it's a lot, but people have been working very hard to try and, you know, present good options and to try and create a plan that addresses the needs of all students and staff. Again, it's still in the planning stages, and it does change daily. We get new information daily. So as soon as the plan is approved, as the superintendent said, we will be putting out details, hold a forum. We actually were working on a guidance document for parents because the plan is over 100 pages long. So we are working on a condensed guidance document for parents and staff with all the important points laid out so that everyone could be informed. And we will have a method to communicate back to us. So at this point, I want to give the chairs an opportunity to let you know what their committees did and how they worked. So first, we're going to have Anne Marie Scott and Bill Black, who chaired the Teaching and Learning Subcommittee, give us an overview.
Good evening, everyone. As Sandy said, I co-chaired the Teaching and Learning Subcommittee with my colleague, Bill Black. He will be giving a little update on the areas of focus in just a little while, but we'd like to give a little more information to who made up our team, as well as the time spent in our area of focus. So our committee consisted of 15 members representing elementary, middle, and high school. We had teachers, coaches, support staff, including a school social worker, a psychologist, a speech language pathologist. We had union leadership, central office staff, administrators, a parent community member, and a school nurse teacher on our team. We thought it would be best to split our team into 2 groups, and so we divided our work into an elementary and secondary time frame when we met with everyone. And Bill and I would just like to take the opportunity to publicly thank our team for the countless hours they spent coming up with the best plan, as well as their professionalism. Our team started meetings on June 22nd, the Monday after school got out, and we met for 3 weeks, a couple of times a week for multiple hours a day. we finished our work just this past week. At this time, I'm going to pass it over to Mr. Black, who will speak more about our areas of focus.
All right. Thank you, Ms. Scott. Thank you, everyone. Our focus on the teaching and learning team was around improving distance learning, getting more consistent for students and families. So everyone in the school, everyone in the district would have a similar experience. Obviously, we know last year we were all thrown into it and it looked different. So our goal was to have this plan come up with more consistencies for teachers and students and families. Along those lines, we wanted to add some structures into place. The surveys that were taken from different schools and in the district talked about asking for more meeting times, more face-to-face meeting times during distance learning. That's what we put forward in the plan. Also setting expectations for all, so there's clarity on what's expected and what everybody's role is, including the increased role of parents and able to support them. And increasing student accountability. So finding support for our student to hold all students accountable, just as we would when they're with us in the classroom. Another focus of our teaching and learning committee was around building relationships and spending time at the beginning of the year, re-engaging students and staff. It's been a long time out. We understand there are a lot of needs for all, so we want to make sure that that time is taken at the beginning of the year and throughout the year to continue to build relationships between staff and students. Another goal that we had a focus within our committee was attacking the learning loss. So we understand that there's always a summer slide, and the way we went out early, that learning loss will be greater. So we talked about different ways at all levels, elementary and secondary, on how to assess students to find out where they are and to close those gaps. And lastly, we focused on communication with families and how important that is. And if we're helping out our families, then we know we're helping out our students. Those were some of the big areas that we worked on, as Anne-Marie said, with the team. And just to echo what she said, we had a great team. We had awesome discussion throughout the last few weeks. And we really had a dedicated group of teachers that helped us with this committee develop a really strong teaching and learning vision for what distance learning, in-person learning, and the hybrid model would look like. That concludes our what we had for our teaching and learning team.
Thank you. Our social emotional learning committee was chaired by Len Anderson, Director of Pupil Personnel, and Dr. Robert Perry, Principal at Riverside Middle School.
Good evening, everyone. Thanks for giving us the opportunity to share our work with you. As Sandy said, Dr. Perry and I led up this subcommittee. And I'd also like to take a moment to thank Lisa Pita, who also helped support the SEL development and plan that we have submitted. We broke into 3 groups. We had 14 members on our team and various numbers of specialties, union leadership, very similar to what Anne-Marie presented, teachers, school psychologists, building administrators, central office. And we were asked to take a look or provide a number of assurances to help support the social emotional the social emotional well-being of not only students, but our staff as well. It was very important as we developed this plan that we make sure that we have a heavy focus on both students and staff, and that we have many of the elements that we were looking for already in place through our MTSS systems. But our goal was to actually be able to provide some assurances and evidence to RIDE and how we will actually support the social and emotional well-being and the health of students across the district. And so we have a few things. Oh, and also to bring in our community partners that will also help support students and staff as well. And so we had a number of meetings beginning right away when these groups were established, working many hours to put together what we believe to be a robust plan to help support. And Dr. Perry will give you a few more details of that.
Thank you. Many of the assurances that Leslie pointed out that were required by the Rhode Island Department of Education, they required things that the district has built upon during distance learning. Our social workers, psychologists, the administrators, we experienced a lot of the things that we were required to address because of that distance learning situation over the past 3 months of school. Much of what we requested had to do with surveys of the SEL needs of students and families and staff members. We've already surveyed our families and our staff, and we're in the process of deciding on the tool that we will use to measure the SEL needs of our students throughout the year. Other than that, we were required to put together SEL committees that Superintendent Crowley and Leslie Anderson, our special ed director, are working on. And we'll be ready for this when we return on August 31st. And finally, Leslie has developed for the district she's in the process of developing really fantastic resources website that's going to have many of the things that we will use going forward that families will be able to access, and students and faculty members as well. And this is going to be an important part of meeting the needs of the social emotional needs of our kids going forward. Thank you.
I just want to add one thing, is that we are very clear that regardless of what the model is, whether we're in person, hybrid, or fully virtual, that there needs to be ongoing support, and that folks are going to need to access that regardless. This is developing the social emotional plan was not, cannot be a one and done. That even if the virus were to magically disappear tomorrow, people are going to need support. Families need support. Staff need support. Students need support pretty much across the board. And I do believe that's going to be for the entire year and even going forward into the following year, given the impact that this has had on so many lives.
Thank you. Next, Diana Clocken, our Director of Operations, was the chair of the Business and Operations Committee.
Good evening, everybody. I too would like to go ahead and thank the subcommittee that I worked with. The committee was comprised of 15 individuals, and we quickly determined that we needed to split the group as well. So we had more or less 50-50 split of transportation and business, as well as meals and dining and business operations. So I couldn't have asked for a better team. Like Anne Marie had indicated, they worked tirelessly, put in a lot of hours, had really good feedback and input, and I was proud to head up the subcommittee. So I thank everybody for doing their share on my committee. Let's first just, talk about dining. If we go to a full distance learning model, it'll probably look very similar to what we had in the spring. We have talked with the bus company about doing the same thing that they will do with the meals at bus sites, or I'm sorry, at bus stops and at individual sites that we set up across the district. Things will be a little different because obviously we cannot sustain a lunch program to feed everyone. So it would have to be determined upon free and reduced lunch and paid lunch, and rolled out from there. As far as what it looks like in school, Elementary school, school children will be eating in their classrooms. Middle school will be similar with the exception of strategic point kiosks will be set up while they come in. So breakfast can be sort of a grab and go situation. And at the high school, we will be doing the same thing. I'm sorry, middle school will have their lunch in the classroom as well. And then with high school, it will be strategically pointed kiosks in the building, including the CTC, so the students can get their lunch and then go back to the classroom for either breakfast or lunch. If in fact we go with either model, or we have to go with either model, I should say, it would probably be cold lunches. At this point in time, it'll be hard to rotate a hot lunch at the beginning, but that doesn't mean we won't. Similar to what we did with the distance learning model. Because classrooms will probably be needed and preparation of the lunches will be needed, I'm going to have to indicate that a portion, if not all of the cafeteria, at least at the high school, will need to be off limits. And we've already talked to that committee because of the food preparation and contamination to food, the food process. As far as the transportation, we sent a very general survey at the beginning of the subcommittee discussions, just asking if people were coming back, if they utilized transportation, et cetera. We also worked on the premise that we're going to use our current fleet of buses. Now, this takes into consideration our vulnerable population, our regular ed students, as well as private, parochial, and charter schools. So in any event, or in any way that we go back to school, we have come up with the fact that we would be looking at a mileage push out. There's just no way to determine anything else besides that. We're hoping that once we do figure out and get more plans from RIDE, we will be able to then drill down on who will be coming back, who will be using transportation. But in all cases, we're looking at transportation for buses at least mileage will be pushed out. We're going to ask parents to carpool or drive whenever possible. And if we go back with the hybrid, we were looking at possibly, again, vulnerable populations first, transition grades second, and then doing a lottery at the high school. But any way you slice it at this point in time, it does look like there's going to be a mileage push out. I think I hit basically the high points, and I don't want to belabor any further if there's any comments.
I just want to add the reason that we have to deal with the mileage push out or some other form of reducing the number on the buses is because right now the guidance from the Department of Health and the Department of Ed say that we can only have one student per seat unless they're siblings. So that's reduced the busing capacity a significant amount. So that's part of the reason we had to come up with these alternate transportation plans. Thank you, Diana. And finally, we have Principal Lori Marchand, who chaired our Physical Environment and Safety Committee.
Good evening, everyone. I had the distinct pleasure of working with 14 members of our community on the Physical Environment and Safety Subcommittee. The members of this committee were made up of a variety of stakeholders, including a member of our own school committee, one of our directors, many teachers, principals, secretaries, custodians, and parents. Our committee met together on a variety of occasions, but also had the need to divide into 4 subcommittees based on the scope of our work. We began meeting on June 22nd, and for well over 40 hours of work that were put in, we completed our recommendations on July 8th to the task force. It's important to note that this committee, as well as every other committee, specifically took every single consideration of health and safety of our students and our staff into every single recommendation that we put forward. These dealt with overall building use and procedures within the school building. Our main focus was to look at every student's actions from the moment they come off the bus, essentially, or out of their parents' vehicle until the moment they get back onto the bus or into their parents' vehicle or they're dismissed. We took every single grade level in every single possible scenario when we created our recommendations for our full in-person, partial in-person, and limited in-person recommendations. Our team studied the guidance that was shared from the Rhode Island reopening documents, as well as from the Department of Health, as well as the CDC. We took these all into consideration with every single recommendation that was put forth. Recommendations were made to the task force that honored each of these reopening models on July 10th. For general space and movement recommendations that were made to the task force, these were limited to, but certainly, these included but were not limited to the group size. That changes at every single stage of our recommendations based on guidance from the Department of Ed. What would classroom layout potentially look like at each and every level? All the way down to hallway traffic. How will we enter and exit every single one of our buildings safely and in a healthy manner? We then studied overall student schedules, and those recommendations were made spanning the guidance anywhere from what recess may look like in an elementary school to passing times at the secondary levels. Anywhere from a suggested schedule at each and every grade span, all the way down to recommendations for schedules of restroom use. Again, following the guidance of the Department of Health and the Department of Education. We had our health and safety recommendations encompassed the health and cleaning measures during all aspects of the school day, both during and after students leave. And we had a tremendous amount of help from Tony Fayola, as well as Diane Wallace, our district head nurse, and all of their best thinking and recommendations from their experience and their colleagues throughout the state. So this was a monumental task for this committee, and it was an absolute pleasure to work alongside such professionals that had forward thinking, outside of the box, honest and open dialogue, knowing that what we were putting forward was best for students and staff. So thank you very much.
Thank you, Lori. So that's an update about the work that each of the committees did. And we continue to work daily on reopening plans for all scenarios. We are following the research around the country and around the world. We are looking what other districts are doing all over. And we just continue to address the issues as they come up. We feel like right now we're a week ahead of where we were supposed to be at this point. So that allows us a little more time to continue to plan for additional issues that may come up, and to put together guidance documents that no matter what scenario we come in at will be helpful to guide us forward.
And again, we just want to emphasize this document is fluid. So what we're telling you this evening could change in another week or two. things could look very differently. Superintendents are meeting twice a week on Tuesdays and Thursdays. The East Bay superintendents are meeting weekly as well. On the superintendent's calls, we are meeting with the Rhode Island Department of Ed and also representatives from the governor's office. So we are keeping tuned in to all areas of interest as relates to the opening of school, but we're following the governor's recommendation that schools will open. You saw the calendar at your last meeting. There is now a statewide school calendar, which shows the opening for August 31st.
In addition to all that, we actually have been doing building walkthroughs into every classroom, looking at spacing. So, you know, we're doing everything we possibly can to make sure that we explore every option at this point.
Can I ask a question? Actually, a couple of questions, if you don't mind. First one with transportation, Diana, or whomever. Are we working with, is there a representative from the police department at all involved? Like when we talk about, and I understand if we're back in the building and, you know, with bus limitations and we do have to expand that walking distance, you know, are they kind of prepared to be engaged when we talk about crossing safety, because now we're going to involve, you know, other intersections that right now don't play a part?
That did come up. We did not have a police representative on the subcommittee. However, that is one of the, when we put the guidelines in place, the assurances and the evidence to ride, the police department, the fire department, the police department, the Rhode Island DOT, and even our planning and transportation maintenance group at the city level would all be involved in the more detailed discussions. So this way, if in fact we do have to do that and put in more guidance, because I mean, I didn't really go into the nitty gritty, obviously, but we talked about crossing guards. We talked about different routes that the buses would have to take to minimize some of the crossing. So we did do a lot of that, and we do have it on the detailed sub group notes.
No, I appreciate that. I kind of I assumed so, but I thought it was, you know, worthy of you know, kind of asking and making sure, because I think you know, parents will definitely want to know. You know, that's the first thing that pops up in my head.
Just to add to that too, we also are still exploring other options. We've looked at RIP to bus schedules if we have to push the mileage out, and possibly RIP tickets for students, high school more, you know, walking school bus, you know, all of those options we are continuing to explore. We have the base of the plan, and like I said, we're building at this point, starting to build everything out.
Okay, and thank you. One other question, if I may, Charlie, on the teaching and learning piece with I know it's Principal Black, and I know I'm forgetting who passed it off to him, but yeah, thank you. I mean, you know, I think about this, if we don't go back into the building, obviously we have professional educators that also will likely have children that are at home with them, right? And because I appreciate and recognize it, the need to increase that face-to-face, that instruction, as opposed to kind of self-learning, which we were kind of dropped into. Are we talking about, or I would imagine you guys are looking at maybe recorded sessions? Right? I mean, I know working with BU faculty this week, and we were talking about that as they prepare for students, and you know, they're basically going to be doing pre-recorded on some of their programs, because they have to spread out students in the simulation clinics, and they're basically, there's not enough time in the day to do live instruction that coincides with every student's schedule. So is that something that we're looking at as well?
Yes, so we did talk about that. So we talked about, we want more face-to-face time with students. There were classrooms that had more of it than other classrooms. So we do want to give better guidance to teachers about what the expectations are as we move forward if this continues. But we also recognize that not all students can be on a device at the same time. We have issues with daycare, that their grandparents or family members not have access. So we have talked about recording lessons, and having those be accessible to students at other times. And the teachers that may have to present that way due to circumstances.
Right, yeah. Like I said, I'm trying to, I think we have to be sensitive to the fact that a lot of our teachers are taking care of their young ones that are not in their own school building. So there's definitely a juggling piece. So, okay, I appreciate it. Thank you.
Dr. Ferrand, I think in general, everyone did a fine job. As my link.
Charlie, you keep going in and out.
Yeah, I know. I can see that on my end too.
Oh, okay.
There are many details that are missing. And I know the plan says on August 3rd, a plan will be published to the parents and administration staff. A plan will be published so that everyone knows what our plan will be. But I think there are, in many places, details that are important that parents will need to know. I think the busing issue, we need more information on too. And I am wondering about, and maybe Mr. Fiola can help us with security and safety. What are our requirements? Did you hear much of that? Security and safety, many details that need to come out. And I know we're taking more surveys, but there are some solid numbers we need to iron out, I believe.
Right. So we do recognize all of that. We are waiting for the Department of Ed to approve our plan. As soon as they approve that plan, we're going to put out all those details. We very much hope to have it out. I mean, the Department of Ed's guidance was that it had to be, plans had to be put out on July 31st. We are very much hoping that we have the entire plan to put out before that. As soon as, we didn't want to put out plans that weren't approved and then have people start to plan how they're going to come back and then things change. We know things are going to change, but we didn't want to add to that by putting out something that wasn't approved yet. So as soon as that plan is approved and we make any modifications that we need to, we plan to have a virtual forum for parents where we have another meeting and we can give all those details. We're going to publish the entire plan, which is very lengthy and not really user-friendly. So that's why right now we're working on a guidance document that would really highlight all the details that you're asking for. So parents could look up, if they want to know what we're doing about health and safety, here it is. If they want to know what we're doing about dining, here it is. We will be doing more drilling down of the transportation because that is a big issue, trying to find out who has other ways to get to school if parents could transport. So we will be looking at another survey for people that do use the buses to try and, provide as up-to-date information as we can. It's just so many moving pieces, and with things changing every day, we just want the guidance that we put out to be, as solid as it possibly can, and, so that people can plan for our return if that's the way we go, or if we go to distance learning, that they can make plans for that.
Yes.
So Sandy, in the event that there are students with a weak immune system, Is there guidance on that? I mean, we may have some staff members who find that they have weak immune systems. What's the guidance specifically more for the students?
So right now we are looking to put together, we're hoping to have a distance learning option for those students. So students that have weakened immune system, we would want, at this point, I think we would like parents to reach out to the principal. If they have a doctor's note, they can provide that to the principal, and we'll start to plan that. We are looking at staff that may not be able to come back and seeing if they'd be able to do maybe some distance learning, if that's an option. Again, we know all of these needs, and continue to make plans for them. Every time every time we come up with a solution to a problem, 5 more problems pop up. So, we are addressing everything that comes up, and trying to have a written document that addresses each of those issues. So we will be reaching out to staff again. We did do a survey of everyone. We'll be reaching out and looking for staff that may have issues returning, and trying to plan with them. So the best suggestion for parents that don't feel students can come back because of compromised immune systems would be to reach out to your principals and make them aware of that.
There is an emphasis, as you have said, on safety. So that's at the top of the list.
First and foremost, that's how we started the meeting when we brought all the subcommittees together. Student and staff safety is our priority.
But I will say, I want to see the schedule of bathroom breaks. I want to see how that works. Okay, that's not a criticism, but in real life, it can be a challenge.
Yeah, so I can give you an idea just of what our thinking is behind that, and then principals will be creating that for each individual school. But we've given high-level guidance to the principals, and they all have access to the plan right now so that they can start reviewing. But we would schedule bathroom breaks for every class multiple times a day. And then there would be an additional bathroom. The other bathrooms wouldn't be open, but there would be an additional bathroom. So if a student had to go to the bathroom outside of their scheduled bathroom break, they would use that bathroom so that the custodian would know, and the custodian would be able to go and clean any of those high touch surfaces that the student may have used. So, we have detailed plans in place for things like that. But the schedules for each classroom will be left up to the principal, because we also need time to wash hands before lunch, after lunch. Those types of things need to be built in.
I'm sorry, Sandy, you talk about, the details that aren't there yet. And I appreciate, not putting out information that could change, because, it's not necessarily whoever hears it the first time may not get the
Right.
corrected or updated version. And I would imagine bathroom schedules like that will even be impacted if we have, there's a variable of the number of students that could be in the building, be in a
Right.
classroom. So what does that schedule look like, right? I mean, if we're at 50% capacity versus 30% capacity, then that detailed plan will look different, when it's put in place. So, sounds like, and it was touched upon, with that safety piece. So it sounds like you guys, which is comforting to know that a lot of the questions that I'm getting, from residents, it's part of your discussion.
Yes.
So I appreciate it. And
Sorry. We've ordered
go ahead.
signs for hallways, one-way signs. Principals are in the process of planning out directions on how student flow can go in their buildings. And we have signs that will be coming in soon. We have ordered PPE. We have ordered face shields. We feel that we have ordered everything that we are going to need to get the year started, and probably through the first semester. So, I know there's not a lot of details out there, but we are considering everything. And like I said, once we address something, then someone else brings up 3 more issues that revolve around that one issue, and then we work to tackle those issues. So, and a lot of this is in that plan. We have, plans for using the bathroom. We have plans for dining. We have plans for ill students or staff. Those are all outlined in the district plan, and they're clickable links. So you could read the procedure that we've put in place for all of those. And that's why the document right now is 105 pages when you print it out, and continues to evolve daily.
Dr. Fran, I think you've done an excellent job coordinating all of this. Thank you.
Thank you.
Okay, thank you very much, Sandy, and thank you, chairs of the committees, and also people that worked on their committees that maybe tuned in today. It was really very appreciative, and we have a lot more work to do as soon as we get our okay from RIDE to move forward.
Kathy, what are we at? Was it 60, roughly 60 in total amongst all the committees?
Oh, at least, yes, at least
Right.
that in the steering committee. Yes. Yes.
Is it okay? I just want to say, I know being on one of the committees myself, I just want to thank everyone, especially the people that are on here today, the time and effort that you guys have put in on this. I know on Friday after I left you guys, I literally, personally, it was very difficult to, continue my day in front of my child. It was hard to hear a lot of what we talked about, not knowing what is going to happen. I will let you know that I think that this is a great group of people. Number one, I wouldn't want anybody else doing this right now. You guys all brought something to the table, something different. I'm very impressed. Once again, even Fridays, different stuff was coming up. Over the weekend, different things have happened. So I don't necessarily think that we're going to have all the answers. So I just want to be very appreciative of what you guys are putting in. I know it's hours and hours of work, and no matter what we do, we may not get it right, but I at least know that all of us are out there to make sure that our kids and our staff is safe. And I think knowing that all of us feel that way, I think we'll at least be on the right path. So I appreciate it.
Thank you. The next thing on the agenda is I asked Diana if she would give you a brief description of how the registration is going. The transportation update is part of her plan that she already talked about, but a little bit about the online registration and how well that is actually going. Diana?
Yep. So since we went out in the spring, we put all of the documents online for parents to download, and then the requirements, and then they've either taken a picture, they've scanned it, emailed it back to the department in order for their child to get registered. It's going very well, very smooth. I can't say enough for the work that Maria has put in as well. She worked very hard while we were out. And for kindergarten registration, we've already enrolled 314 students. So, a couple of hundred maybe from the preschool, but still the paperwork and the follow-up was necessary there. But everyone has been quite satisfied with the work that has been done with the registration. I do foresee it getting busier. And for those of you who don't know, the registration department and transportation departments are now at the CTC. We moved over late last week, and we probably will still continue with the registrations being done online. However, we will be doing appointments as well. We have pre-K registration coming up, as well as new students coming in. We get phone calls on a daily basis. The phone numbers right now, we're having a problem with one line, and that's mine. So I've put out my on Twitter and the website my cell phone number. So this way, if people have a hard time getting in touch with the department, they can at least get in touch with Maria at her number, which is the 383-5745, or my cell, which is 680-2346. So this way we don't want anything dropping by the wayside or people not being able to register. So again, we've had quite a few, and again, it's been very, very positive with regards to the online. We're also looking to, once we roll over Skyward, which means that the student information system needs to roll over to the next grade. We're also looking to put everything online. So this way it'll just be one program, they can fill in the fields, and then that information gets downloaded and comes directly to us, as opposed to the documents being online, them having to, download or print or whatever. So this way it just streamlines the process a little bit more. So I have to say that, again, it's been going fairly well. And as far as transportation goes, I want to reiterate what Dr. Foran said with regards to, we haven't put out a lot of details, and maybe I went a little bit too quickly for you, Charlie, but I just want you to know that our committee worked very hard thinking of all of what the could ifs and or how it could go. So I don't want you to think that we're, shirking either looking at different scenarios or not. We've tried to look at everything and everybody, and the stakeholders that were involved, came to the table with a focused view on how to get the students to school safely. So.
Thank you, Diane. I think we have a long way to go, though. I don't think we're there yet, but I think we've begun, but we still have. Is Ben Russell there?
I'm here.
Ben, I keep losing my link, and I'm in and out. And Tony Ferreira has a couple of questions, but can you reach out to Tony Ferreira, because he can't seem to connect with you over the meeting?
He's unmuted. He's unmuted now. He's Tony. Can you speak?
Yes, I can speak now. I have to back up a little bit because I don't know how long I was muted from when we started. A question I have: can anybody on the committee let us know how many people in East Providence been tested? Because the question that I have, the big push throughout the country is for people to get tested, so we have an idea of how many people in the city test negative, test positive going forwards. And second, would it be allowable to let us know how many staff members we have at the vulnerable age limit? Because I understand this is all coming from RIDE, but it's I look at it as it's kind of hard to send something down from RIDE if different communities have different criteria to meet the same standards that is coming from RIDE. In other words, if our population of the vulnerable age is, say, 22%, but Providence is only at 8% because they got a lot more younger teachers, how are we going to meet the same criteria, and not knowing how many people, mainly parents and adults in East Providence, been tested, to have especially high school kids where the graph is showing now that, the 18, 17-year-old kids can get this and spread it, to have high school kids going into high school with teachers that are on that vulnerable stage. That's some of the information that I don't know if they gathered yet, if we can get that. And second of all, did we research clean air machines to circulate air? We have some buildings that windows don't open. Have we gone to that level yet, or is that the next stage that we're looking at?
So I can answer that. No, we have not inquired about how many in East Providence are being tested or not who belong to the school community, Tony. I am not sure, and I'd have to look into that, whether we'd be able to get that information. We can give you the number of teachers and professional staff, Cheryl could get you, that are over the age of 60. And yes, we have looked at that. In fact, there is a survey out presently to all staff, asking them about whether they would be coming back or not. Is there some type of an autoimmune system or a condition that would prevent them from coming back? I think Charlie mentioned that as well, and procedures for dealing with that. We need to know that about all staff. If there's an underlying condition, we probably follow some of the 504 protocols, which would ask for medical documentation of that condition. And then in consultation with our lawyer, we're going to be handling that on a 1-to-1 basis. But we can give you the approximate age of the staff that is over 60. We can do that.
Right, Kathy, because that's what I'm saying. Like, even if we have some that, that may not have, a medical issue at that point, I myself, if I, at that age, have to enter, mainly the high school I'm looking at, because to enter in a high school with, with the teenagers, the 16 to 17-year-olds, not knowing where we are at testing in the city, that may be a driving factor for me to say, if I knew that the city is well below, an excellent position, I myself would feel more comfortable going to the high school, not knowing where we are, to say, okay, I'm going to enter a building. I don't know the percentage rate of the city of East Providence. Why would I want to walk into a building, even though with all these, standards and safety issues being in place? I think that's a very important driving number, especially for the older population, to say, yeah, even though I'm in really good shape, the number is so low, I'm going to go in there and do what I've been doing for many years. If the number is at a certain point, I think that's what is out of respect to have these teachers be able to know what they're walking into. And especially today where, we just, hopefully all of us just seen, the numbers in Rhode Island are on that uptrend again. And that's why when Sandy had said every day this changes, imagine coming up with plans last week based on numbers that were here. Today, the numbers are going up. And so are those plans really feasible if the numbers keep rising for the next week or two? At what point which I don't think the governor had stated yet, but at some point, if these numbers hit a certain point, would she say that she would, revoke the order of opening the schools? There's large sums of states now that may have to go back to mandatory lockdown. In other words, where the cases are climbing. That's the information that I think is vital to get to parents, because they have to plan for their jobs. And that's why opening up the schools is a very important thing across the country, economy-wise. But these are some of the numbers that if I had student and I had to go to work to know, the numbers going forwards, I think the sooner we can get these out to the public, I think it's a great help to keep the public informed. And I understand what Joel said, to try to get the true information, but the true information, even though it's true today, it's going to change by 9 o'clock tomorrow morning. That's like that moving bus. That is like a really, really tough scenario to say this is the truth, because today it may be the truth. Tomorrow morning, 50% of it may not be the truth. Doesn't mean that anybody misspoke or said anything like that. This virus is moving on a daily basis throughout the world. And to say that our staff that's coming up with these excellent plans have it locked down, it's not a doable thing. So it could be just very mind rattling for our staff to come up with this based on 5,000 kids and 800 employees, that they're responsible for at this point. So I want to thank them all for the job they've done as well.
I'm going to call the Department of Health tomorrow and see if it is broken down by city or in town. I'm thinking that it must be, Tony, the testing, and I get that in from, yes.
749 people in the city of East Providence have tested positive for COVID-19.
But I think he's asking for the total
Right, that-
tested, so,
Yeah,
yeah.
that I can't find out, but I do have the printout as of
Thank
7.
you. If you
I
send
would-
it to everybody, and let me see if I can get the total number tested, okay?
Kathy, I
I
would
can-
check with the mayor's office.
Yeah, I
Yeah.
would. I'll check with him too, tomorrow. And I certainly can get you all of the staff, including the paraprofessionals, the administrative assistants, and the teachers that are over the age of 60. Cheryl can get that to you.
I can get you
Excellent.
the amount of people tested too. I just don't know their ages.
Oh, okay.
Right, Jess. The only thing, Jess, that like that, and I appreciate that, Jess. But what we kind of look at that, like if anybody that goes into a medical facility now is
Right.
tested and stuff like that, I'm looking at like say like a volunteer, basis. The 2 testing centers we got, are they even open? Is the public going through them? I think the number that you might be looking at, Jess, is if you walked into like a walk-in clinic or you went for a rescue ride to the hospital. I'm just looking at, are we going to try to really, test the city to say, yeah, the city is in great shape. The governor's saying Rhode Island is in great shape, but that's based on her numbers saying, I don't know what the number is, hypothetically, 87,000 people tested. That's great for the whole state. As a city of East Providence, what is our testing rate? And are we going to look to make it higher or increase it for the teachers going into these buildings, in other words? Because, right, you take a high school kid that goes home to mom and dad that may have it, he goes back to school on a Tuesday morning, where's the protocol to check this, in other words?
Tony, I agree with you. And that's a good question. I assume, we've been asked to voluntarily get tested working in the restaurant business. And I'm assuming if I get tested, I would be tested. And I live in East Providence, I would be counted as East Providence, even though I work somewhere differently. And that's the place that they would want to know whether or not I was positive or negative. So, but I do have all that data on my phone, how many people and stuff like that. I just have to pull it up. It just takes a moment, but, I agree. It would be an interesting number to see where we're at and how many people we are testing every day in East Providence. But once again, if, I drove by today, I don't know if the one by the senior center is open anymore. It didn't look open when I drove by today. No.
Excuse me, Jessica, that data, that you're looking at, I look at that daily as well, but it can be misleading because the communities that had high populations of nursing home victims,
yes,
their numbers are very much higher.
Correct.
East Providence being one of them. Of those 700, I believe there's a couple of hundred of nursing home victims.
I have at least 246 on mine that are from at least 4 of the nursing homes.
Right, like North Providence had a high number. Certain communities have very high numbers, not necessarily because of the spread among the community, but they have large numbers of nursing home victims, unfortunately.
Just those nursing homes, correct?
Right. So that would also, if you're going to be looking at numbers, we also need to, because East Providence is high, but again, we had quite a few, like you said, 240 deaths.
At least, yeah.
Right.
And then the next question that I have, if maybe Tony can answer this, and Kathy as well, not sure Kathy is going to answer this as well, but is there a plan to increase any staffing to maintain the buildings, like where the kids, if we do open, are going to be eating in the classrooms and stuff, custodian staff, because it's going to be, I'm just saying it's impossible, in other words, to have these kids all eating in classrooms, have 1 custodian, 2 custodians at an elementary level. Have we looked into that, what the staffing increase would be for this program?
We know it's on the horizon, Tony. What we have looked at is changing the schedule of the night custodians and having them come in at an earlier time so they can help with the lunch cleanup. And then at the end of the day, where at that point, we are not at the point where we have talked about hiring additional staff, but we very well could be at that point. if things don't change. We very well could.
Okay, thank you.
Okay, thank you. If there are no other questions, I'd like to move on to the Director of Human Resources report. Cheryl Mamoni.
Good evening.
Oh,
How are you?
Good, how are you?
Good. So this evening, we have one, excuse me, we have one retirement this evening. Mary Beth Finn. She's a special education resource teacher from the high school, effective 8/31/20. Mary Beth Finn is retiring from the East Providence School District as of August 30th, 2020. She has worked for us for a total of 15 years. Mary Beth was hired September 6, 2005 as a special education teacher at the East Providence High School. Her most recent position has been as a resource teacher at the high school, and this is the position she will be retiring from. We'd like to wish her a long, healthy, and happy retirement.
Congratulations, Mary Beth. Can we
The next, we have some recalls. These recalls will be all effective for the 2021 school year. We have Lucia Tavares, a paraprofessional at Martin Middle School. Alina Rose, a paraprofessional at East Providence High School. Melissa Leet, a paraprofessional at Silver Spring Therapeutic Program. Sheila Oliver, a paraprofessional at East Providence High School. Marcia Tellini, a paraprofessional at White Neck Elementary. Kelly Groff, a special education life skills severe and profound teacher at Martin Middle School. Cherie Kelly, math and numeracy teacher at Riverside Middle School. Nicole Foster, reading teacher at Riverside Middle School. Mackenzie Walker, grade 1 at Kent Heights Elementary School. Emily Gonzalez, grade 5, ELA at the Silver Spring and Kent Heights schools. Renee Willette, a resource teacher at Kent Heights. Caitlin Dorney, library at Kent Heights Elementary and Hennessy Elementary. Mindy Mertz, a special education pre-K teacher at Oldham Elementary. Abigail Jaffa, a therapeutic teacher at Silver Spring. Katie DeBlois, grade 2 teacher at White Neck. And Gabriella Grillo, a grade 2 teacher at Silver Spring.
Shall we have a motion to approve the recalls?
I move to approve.
Is there a second?
I'll second it.
It's been $900.
Did we get a second? Because I lost the break there. Okay, we have a second. All in favor signify by saying aye.
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 Aye. Any opposed? Motion carries.
We have no leave of absence or non-renewals this evening. Thank you.
Thank you. Director of Facilities Report, Tony Fiola.
Good evening. Enclosed in your packet this week was the updated reports from all elementary schools except for Waddington. That's the school that we're currently walking through right now, looking at things that need to be repaired, ceiling tiles, valves, those type of things. But you can see each school is broken down. There's some items that we're still waiting for on certain schools, or for our electrician and painter to catch up. But you can see all the items that they've worked on. Also enclosed in your packet is the custodial project list for the summer. Added to this list, starting today, the custodians are also assisting in removing all large items other than student desks or tables, chairs, and the teacher's desk from classrooms, so we can prepare for the 2020 school year, needing our 6 feet of space between student desks or tables. So we are working on that project. We also broke down for you what they're doing in the buildings. We also had at the high school, Martin, and Riverside is just starting right now. We've been cleaning out some of the book rooms of all the old books that are in there and recycling them with the city. We have sent 20 Gaylord boxes out of the high school, 5 out of Martin, for a total of 33,000 pounds of recycled material for the city to take credit for. So that's done. Our electrician has just finished all of the changeover from fluorescent to LED at Riverside Middle School classrooms. He just finished the main office. We are continuing at Riverside to finish up the hallways. And yesterday morning, we put up the test lights at one classroom at Francis to finally find a light that will change over our fluorescent in those classrooms to LED. Last but not least, as Dr. Moran and the superintendent had said earlier, we are continuing to bring in PPE and items that we will need for the opening of school, including but not limited to safety equipment, signage, gloves, heels. So we're getting all that in stock. We still have some items on order and some items on back order, but we are tracking them all week long.
Tony?
Yes.
Yes. Tony, how we doing? Tony, I got a couple questions. The sample light at Myron J. Francis, did you think that one's a go? The one that you said you might have put it in yesterday or this morning?
I did. I photographed it, and I'm just comparing the two sets of lights. But I do think that's going to be a go. We do not have to penetrate the ceiling and go all the way up to the roof, like we looked at. These are full 8-foot replacements, so we'll replace the 2 8-footers. And similar to what we saw, where the light came down, it didn't go up.
Yeah,
this unit
exactly.
It's an actual replacement, Tony. It goes in both directions.
All right, nice. Second, Tony, did we look into, because I know so like where the windows don't open, are we going to be looking at anything to scrub the air to circulate some fresh air into the buildings? Because the only concern that I'm going to be looking at going forwards is if we do go back to
not every
the beginning, the end of August, like if our buildings, we know high school is second floor, if that building starts to really climb in temperature, last year we would move some classrooms, and then if we fast forwards a little bit, we know as the high school is getting older each year, we get a little more situations with classrooms that are going to be cold, but the students either got moved to another classroom or they kind of tolerate it because 45 minutes later, say they went into a classroom that was, warmer. It just going forwards, Tony, if we can kind of meet and see where we're going to be going with them two scenarios, unless the team had already went over that, I'd like them to update all of us on the school committee. Where would we be going with that?
All together, we're looking at some ideas, and I will submit them to the superintendent.
Okay, excellent.
Tony Fiola, question along some of the same lines on air conditioning. If a PTO
Sorry, Charlie, I lost you.
Yeah, no, Tony, if a PTO or a PTA said, I'd like to put an air conditioner in a room, they should coordinate through you?
Sir, the only thing we have to look at is the amount of electricity being used in that building. Similar to the problem that we had at Riverside, we had to bring in a whole new service upstairs just to get those air conditioners in. So they don't plug into a regular plug. We would have to bring power to the room.
Well, Tony, Charlie, just to follow up on that, if we have to look into this, because I'm here, everybody's spending COVID money on everything that is known to mankind. If we have to start spending money on air conditioning large portions of our buildings, if we can't keep them socially distanced because the buildings are heating up, then if that's not COVID related, somebody's going to have to explain to me what is COVID related, because normally we'd be able to move our kids from one portion of the building to another to adjust either the heat or the cold. So if we can no longer do that, if we do open and everything's looking really good, but buildings are starting to get too warm, which we only got about, hopefully, that 2-week period, maybe 2.5. I would be a little more concerned about when the winter gets here with rooms being too cold, but that we're not going to be able to put them into open classrooms, because from what I heard earlier, all of our classrooms will be utilized to make sure we meet social distancing. So those are other scenarios going forward that I'll work, through the superintendent, Tony, work with you, get some updates hopefully the whole school committee gets them, going forwards. And then another question I have for you, Tony, if you can look into the fire alarm. In other words, if we're going to go with corridors that are all one way, does that get scratched when a fire alarm goes off? Because we know all our schools are set up for the kids to exit at the nearest and closest exit. Is that going to be something that we would, if a fire alarm goes off, we would go into our normal fire alarm drill exit pattern? Or with the situation we're dealing with now, would we still try to keep corridors one way?
So when I first went to Riverside, right, there's a center stairwell.
Yes, we would revert in any fire alarm emergency. We would revert to get the students out of the building as quickly as possible. And then once outside, we'll move each pod away from each other more than they are now to that 14 to 15 foot range.
Okay, excellent.
And Charlie, I think if you refer the parent to Tony Fiola regarding the air conditioner, that would be fine. And we will look into it depending on what school it is. I don't think Tony will have the issue of moving high school kids in the appropriate out of rooms that might be too cold, Tony, because we're looking at, them not coming in sort of on alternate days and not having the whole school in there at once, because of the inability to social distance. So I think that won't be a problem on the high school level. So
Tony, yeah, I'm sorry. Tony,
Tony.
Yeah, okay, I will. Thank you,
Okay.
Kathy.
Yeah.
Tony, one more question about playgrounds. What can you tell us about the playgrounds and sanitation, and will they be used? Thank you.
So I can answer.
Charlie, that whole conversation broke up, Charlie.
Yeah, no, my question was about playgrounds.
Yes. Charlie and Tony both. I'll defer to Dr. Ferran on that. That is in the protocol in the package.
It is in the plan right now. So right now, the playgrounds would not be able to be used because they would have to be walked down between every stable group. And stable groups, even outside, have to be kept 14 feet apart. So we would look at getting equipment that only that class could use. And that is actually all outlined in the recess policy that we have in the document.
Okay,
I guess we're good.
Charlie?
No, I'm back. I
Oh.
went out for a minute, but no, that's what I wanted to confirm, because it's we don't know, and that's not likely to change anytime soon, Dr. Ferrand. Is that correct?
I don't believe so. As long as we have the stable groups, and as long as we have the requirement of 14 feet in between stable groups, every surface would need to be wiped down before another group could use that. And I don't believe we would have the ability to do that. So as of right now, the recommendation is that the playground equipment not be used for recess.
Okay, thank you. That's all the questions I had. Anyone else have anything for Tony Fiola?
Not for Fiola, but I did have a question, just kind of parlaying off of the playground thing. I meant to ask with the team. With the elementary students, obviously as we're, we as in you guys, your team is going to be juggling that plan. And, I'm thinking about the social emotional piece. So should we anticipate, weather permitting, more outside access to get these children kind of up and about, and, because obviously the conditions are going to be, even if not obvious, there's a level of stress that better than I do as an educator, right? That these young ones are going to deal with. So
that's going to be our recommendation to, lunch could be outside. Teachers could take them outside during the day and actually do work if it's a nice day. So our recommendation will definitely, and that is in the report, to increase outside time.
I'll be honest, that's the one thing that I quoted Sandy on from last Friday. I have it in parentheses because she did emphasize that. I just want you to understand that was a big deal for me. And I think at least my group that I worked with, the social emotional, and the fact that they are going to promote for the fact that they go outside a lot, even if lunch, if possible, if they can do that, and anything else. So I just want to make that clear that was never off the table. The only thing that I would like to ask, and if we do, so individual, I know in the past, classroom, individual classroom balls and stuff like that have been purchased by the PTA in recent past. Now, I would assume that stuff could be purchased by COVID money if it's COVID related now, correct? Because that's a pretty sum for each classroom. If you need balls, I mean, we can't share anything. If we can't play on playground equipment, what else are you going to do outside?
I think we haven't come down to that point yet, Jessica.
Okay.
As soon as all of this is approved, then we'll look at what the phys ed teachers are going to be able to do.
Okay.
Children outside and things of that nature. But yes, we would have some in our budget to supply those.
Okay. Just wanted to double check that one. Thank you.
No, we'll make sure that happens.
Thank you.
And there's some pretty interesting European models, with what they're doing with the elementary age school. No, as far as the types of games, they're getting creative. The teachers were having to create some high activity, but no contact, no sharing type games that seem to be effective. So I'm sure.
Saw a great game of foosball. Is that the one?
There's a lot of different.
Yeah.
Foosball.
And Dr. Ferrand, what about the special needs children on this same subject?
I get, what do you mean by that? So
on the physical activity.
So the same thing, we're going to recommend that all students, outside whenever possible. We still wouldn't be able to allow any students to use the playground, but, we hope to be able to get them some equipment to use when they're outside. So does that answer your question?
Well, I guess it'll have to, right? Is there another answer at this point?
Well, all of this would apply to all students, including our special needs students, yes.
Okay.
Yeah.
Are there any other questions at this time for Tony Fiola? If not, let's move to our Director of Finance report.
Good evening, everyone. Just a, excuse me, just a few items of note with regards to the finance report. During the month of July is when we have our bill
At this time,
workers' compensation
Tony Fiola.
and property.
Let's move to our Director of Finance report.
Somebody's on
Good
a
evening,
delay.
everyone. Am I good to go? I'll continue. Thanks. So as I was saying, during the month of July is when we pay our workers' compensation and property and liability insurance payments. And so those numbers are reflected on this month's finance report. In addition, on the second page for textbooks, account 56401, you're going to see a substantial increase in that line item as well. We needed to purchase a new ELA curriculum. And so that was ordered, and that invoice is going to be up to being paid soon. So we included that in there as well. And then in terms of revenue on the bottom of page 2, in order for the state to plug the budget hole, so we ended up all of the communities, well, all of the communities except for East Providence receives their state aid every single month. We get our state aid 2 times a year, in April and in October. So as a result, we had already received our June state aid payment. However, all of the other surrounding communities did not and still have not received their June aid payment. And so what the state is doing is using the first pot of money, the ESSER funding. They are using that money to plug the gap. But so what's going to happen is we now have a reduction in our state aid of $1,343,727. That money is going to come back to us. So we are going to apply for the money for the ESSER funds. That application is already out on the Acela grant site, and we have taken a look at it. But the only other piece with these funds is that the private schools and parochial schools within the city of East Providence can access some of those funds. So there will be a slight reduction. We're not sure what that amount is yet because we just opened it up. But as time goes on and as the numbers start to really be confirmed, I'll be sure to let you know what that is. And then finally, just wanted to let you know, during the month of June, I think I told you we started doing the online school lunch applications. We were able to qualify another 15 to 20 families for free and reduced lunch due to the changing circumstances that their families had. We did outreach to some families to see how the application worked, because we just wanted to make sure that it worked well. How hard was it? The parents that we spoke to thought that the application worked very, very well. So we are going to be going full steam ahead with this for the next school year. It's soon to be turned on, I believe, around the 27th of the month. And we're going to be sending emails out to all of the families. We'll have it available in English and in Spanish. And we will still have some paper applications as we need to, but we really do want to get away from as much paper as possible at this time. And that's all I have.
Craig, you want to let everyone know that the city.
Yes, I'm sorry. Yes, thank you, Superintendent. So as you've been aware, with the ongoing discussions that we've been having about the due from fund, that the city is holding some funds that belong to the school department. The city transferred over the first installment of 1.6 million into our cash account. And so that amount is also put in on the revenue section, so that you can see that as well. So 1.6 first installment in our bank account. We're very grateful to have those funds to our cash flow.
Craig, I have a question.
Sure.
So, Kathy, I think we discussed this 2 meetings back. So that's basically how we're funding pre-K at this point with that sum of money.
No, we're funding pre-K with categorical monies from the budget. It's different from that, from the state budget.
Categorical, it's the categorical grant.
Yeah.
All right, so a question that I have, because I thought last time, 2 meetings back, that we had stated that we were going to pre-K, fund pre-K with the first installment. Then it didn't come in front of the school committee, but we all stated that we would support that move, Kathy. But if the governor funds it, that 1.6 million would have to come back in front of us to be voted on where the money is going, because going back a year and a half ago, to the best of my memory, that's what was all discussed with our joint meeting and stuff. So now I'm a little confused somewhere.
Going back a few meetings ago, we weren't sure whether we could offer the pre-K. If you remember, we thought we were going to take a cut in state aid for next year. So talking with representatives from the city, we went with the worst case scenario and we cut 10% off the top of our expenses, which meant we laid off those teachers, those paraprofessionals, the supervisory aides, etc. If you remember that conversation. Then we were told that the categorical funds for next year's budget are pretty safe and that we wouldn't have to worry about those funds, which totally support our pre-K program. Now, the 1.6 that's going to come in is our COVID money, which you have to decide what to do with. For example, we said we could use it to offset the increased cost of transportation. We said that at the last meeting. You asked that question.
Kathy, can I interrupt you just for a second? The 1.6 COVID is not the 1.6 from the city.
No, it's separate. It's COVID.
Right. So I just,
the city. You're
right, Joe. That's what I'm trying to track. I'm trying to track this 1.6 million, where it is now, and this school committee gets to vote where that's going. Am I right or wrong? Like I said, the last conversation, I thought it was for that, because if that's the case, I'm going to put it on the next agenda. I would support, because right now we still got a large sum of educators, call them whatever position they want to fill, that we laid off. But now I'm understanding pre-K is funded through another fund that has nothing to do with the 1.6 million that the city just gave over to us. I would state right now publicly, I would support bringing back as many people as we can with that $1.6 million.
Right.
Because Kathy, if I may, and Craig, correct me if I'm wrong. I'm just to kind of bring this, and this is where I was going with the last meeting, right? To follow the budgeting piece on this, the $1.6 million from the city is simply, and we did talk about this at the joint meeting, it's a cash flow exchange. It does not impact our budget. The budget that we have already approved the allocation line items to does not change. The cash flow allows us to actually make those expenditures on time as needed and so forth. It's cash in hand. So when that came over, it's not an influx of additional money that the city is giving us. It's money that is already recorded in this budget. You know, if you look at that 86,593,969, that includes, always did include the 1.6 as assumed incoming revenue. It's just now we actually received it. So it's in our hand, but it's not an additional lump of money. It's already, so when you go up through all of those different categories of expenditures, it's budgeted in there. So it's accounted for already. It's not an additional lump of money to that, to add to that 86,593. If I misspoke, Craig,
Nope.
Speak now or forever hold your peace.
That's right on the money, so to speak.
Yeah.
Anything else for Mr. Enos? If not, can we go to the policy committee report? Ms. Beauchene?
Okay. So I apologize. I am on my phone for the policy. So we're at the social events. Oh, we probably don't have to go over that, right? Do I have to go over these now, or do you want to wait till we get to the past? So
We can
Okay.
wait unless somebody has a question.
yeah. Does anybody have any questions of any of these? So we're still on the social events calendar one. We're still, and then just so you are aware, there are two, one without names, one with, oh, wait. Yes. So then we have the naming of the facility. And yes, go for it.
No, and I'm trying to find it.
Yeah, it's
on
way
the
at the
naming-
end.
All right,
It's
so at
page
the naming
70.
of the facility.
It's 85, 88.
All right, I'm getting, okay, all right.
So we've been dealing with this
The-
now since April, May, prior to that.
Very minor.
Yep.
Is, I think this is the one I was looking at, was item A.
Mhm.
Where it says the name should be easily identifiable with the school. That would be the school or facility.
Yeah,
correct?
so I guess we should change that to the name should be easily identifiable with the above.
Yeah, with its respective.
Right.
You know, we've
Yep.
got to, just
I
so
see
that it
that.
doesn't single out only for
Yep.
school.
Got it.
I think that was the only thing that I recalled coming across.
And then the legal structure, as you see, it's just posted on the website. It's the same thing as before. The inspection we changed to fall at the request of the school committee. And so pretty much that is it, unless anybody has any questions. And then the social events calendar is via the district calendar by the superintendent of schools at the first of the month. The naming of the new facility does have that added part where the school committee shall have the authority to revoke the name of facility or academic unit in the event that the person for whom the facility or academic unit was named, if the person is later convicted of a felony or engages in conduct which in the sole discretion of the school committee is significantly detrimental to the reputation of the school department.
If there's nothing else,
okay,
we'll go to the building committee report. Mr. Montero.
Yes, sir. Just let me pull that up for you. All right, so I'll run you through the OPM report that we received last night. You know, Charlie, you often will watch along. So permitting, we are, things are moving along. There's some back and forth nothing of any alarm with RIDOT, with the permitting for the sensors, the cycling sensors for the new intersection. As I stated before, we did push back at RIDOT about them requiring us to pave that section of Pawtucket Avenue curb to curb for the length of the property. We did not win that battle, but it is in the GMP, which is under budget. So we're okay. But so that permitting is going on. The next thing, and I will send this to the 5 of you. I apologize I meant to send it earlier today, but I'll send you a copy of this as well. National Grid Incentive Program with the design of the building. You know, obviously it will be finalized after completion when National Grid does their inspection. But we are qualifying for roughly $383,000, $383,429 rebate from National Grid for the design and the components of the new high school. And I think more importantly, that speaks to the level of efficiency that we should expect. I mean, again, night and day compared to what we're working with, it wouldn't take much, you know, I mean, obviously we know that the old building needed to be replaced. And this is an area where we are going to see long-term sustained repeated savings year over year. So that says a lot. That's a considerable amount. Sam, our OPM, had referenced the Veterans Home, which was considered very successful in this manner, and it was still a fraction of what we have for a rebate from National Grid. So that's great news. Commissioning updates. So the building envelope received site visits throughout June, and so that's going along well. Milestones, we've got miscellaneous metals are beginning this month, or began this month. Structural steel painting began this month. Interior finishes, let me repeat that, interior finishes are going to start in September. And then we have our next building committee meeting on the 10th. Yes, it is Victory Day, but as of right now, the building committee members did not have any conflicts, so we will still be meeting on the 10th, virtually, of course. This, you'll see a list of ATPs, which are authorizations to proceed. And again, this is a small group that meets every Monday, or actually now every Tuesday, to approve things that pop up. Some are no cost, others are have a cost associated with it if it's an adjustment that needs to be done. And those will be reported out, and they're vetted just like everything else is. You'll get that. There's a schedule I'm not going to go into, but it shows the amount of trades. We roughly have this week 180 to 200 workers on site with various trades going through, and you'll see there's some images in this file that I'm going to send you. We've actually have the stonework being done on the north side of the building. As you know, when you look at it, the building it's being completed basically, I'm sorry, the south side from south to north. And while we have metal framing, steel framing on the north end, we actually have the exterior finished cement board and stonework being put in place on the south end. Interior walls are going through fireproofing. Things are just going extremely well. So meetings continue. We are, as I said, we had a budget for the building of $157,200,000, and I'm sorry, $157,200,000, and we are $154,388. So the savings there, we did not put away anywhere. We actually moved it over to owner contingency because, again, the GMP that's finalized does include quite a bit of contingency to absorb anticipated unavoidable changes, and we'll keep that money there to be used, and this project will maintain itself under budget. And that is, again, we've added all your fields, lighting, and we're working out a lot of those details there. So, yeah, that's pretty much the overview. If there are any questions, I will do my best to answer them now. If not, I will get them to you.
Joe, yeah, Joe, what about COVID-related expenses? What number would you put on that? How much money we spent on the project COVID-related?
So in the GMP, there's $1 million, Charlie, in the GMP that's set aside for COVID-related expenses. We have not yet received an invoice from Gilbane on the COVID-related invoice measures that are in place. I will tell you, and as you know, I didn't receive a phone call from anybody on the committee, but I know that you guys all received a letter from the trades that I am pushing back on one of those components, one of the measures being taken, because it is a considerable cost. Essentially, they're going through when someone arrives on the job site, there's a trailer there. They self-report whether or not they have any symptoms and so forth. And then there's someone that's there to take their temperature and record their temperature. If the person reports that they're not feeling well or their temperature is high, they go off to the side, wait 5 minutes, and then they'll take the temperature again. If for whatever reason they're considered to be at risk, COVID related, then the foreman on the job site is called out, and they go through their protocol, as their trade or their union, their company requires. But as that part, the piece that I'm pushing back on so that the committee knows is I am challenging, they have a medical technician taking the temperature of everybody there. The guidelines from Department of Health, the trades and so forth that I've read do not require specifically a medical technician. So I'm pushing back because that is costing $750 a day. So, you look at over 12 months, if I'm recalling my math properly, that's about $228,000. And again, I know I crunch a bunch of different numbers, but I think that's the figure that I came out with. So I'm pushing back on that. As I've been, Charlie, if you've been in, well, many of us have gone through City Hall. We have a admin doing temperature taking, and there are other options. So again, just so that the committee is aware, that is something that there is ongoing discussion that we have to address. But the GMP itself has $1 million set aside just for COVID-related expenses. But we have not yet been billed against that line item.
Any other questions at this time? If not, I'll ask Ben Russell, are there any public comment? Any questions?
No, there are no new public comments.
Okay. Let's move on to action items. First action item is to consider and vote to approve the bill list. Any discussion on this?
So, Mr. Chairman?
What was that?
So, Mr. Chairman, if I may make a comment, please?
Yes, go right ahead, Greg. Yes.
Yep. So I'm sorry. So with regards to the bill list, due to an error on my part, so there is a check number 5652. It's on page 3 of the general fund list. That check is not correct. And so I would ask that check not be approved under this warrant. It's related to items 13 through 15 under the action items, and I didn't realize that there was needed to be 2 checks, so it fell under 1 check, which is my fault. So I'm just asking if the bill list could be approved without that check number. And I'll bring
Very
it
good.
for next month.
All righty. Did we have a motion?
Move to approve.
Minus what Craig just asked for.
Correct.
Is there a second? Is there a second?
I'll second minus check 5652.
Thank you.
Motion made and seconded. If there are no other questions, all in favor signify by saying aye. Aye.
Aye.
Are there any opposed? No one opposed. The next item is consider and vote to approve social events calendar second read.
Move to
Any
approve.
questions, comments? There's a motion to approve. Is there a second?
I'll second.
Motion made and seconded. All in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries. Consider and vote to approve organization chart second read. Questions or comments?
Jess, just to clarify, that was, I noticed we had two. That's what I meant to ask you.
Yeah,
And
so
that-
one is without names and one is with names.
Right.
Current
So-
names of people in the positions, and one is to stay without names forever and ever until someone else changes it.
So we're looking to choose one of those. Is that what you're asking?
No, I
Or-
think we decided last time to add both of them so that you can have one
Okay.
that's fluid and one that is stable.
Okay.
We
Move
should-
to approve.
Thank you.
Is
I'll
there, there's a motion made and seconded. All in favor, please signify by saying aye.
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 Any opposed? Next item, number 4, consider and vote to approve naming new facilities, second read. Questions, comments?
I will fix the part A, and the name should be, I will fix that to go along with everything else and then I make a motion to approve.
I will second that.
That sentence just seems funny to me.
Oh, here you are now. Where were you when I brought it up?
Yeah, Karen, we've talked
No,
about
I know, but even not just the facility part, the end of that, like the person isn't being named after. It sounds funny to me. Celeste, can you look at that?
Celeste.
See, look at it says the candidate should have contributed to the school facility that he or she is to be named after. He or she is not named after anybody. Am I?
Oh, I see what you're saying. Okay.
This is worded wrong.
Celeste.
And I'm on the committee, so I mean, I helped write this, but now it doesn't sound right to me.
You have to hold on a moment. I'm still scrolling down to the policy. Read it again, Karen.
No, letter C, it says the candidate should have contributed to the school he or she is to be named after. It should be to the school being, no, I don't know. It just doesn't sound
Yeah,
right.
I know what you're getting at. I gotta read it.
Sounds like you're naming him or her after the school instead of the opposite. The candidate should
Oh,
have-
so how about this, right? So the candidate should have contributed to the school for which
He or
For
she
which
will be.
is being named
he or-
out for which
yeah,
he
he or
or
she will be named.
there
He
you
or
go.
she.
That sounds
Yeah.
better.
He or she.
Yeah. Right. So the candidate
Yeah.
should have contributed to the school/facility for which he or she shall be named. Is that correct?
No,
Dr. Bola?
no, because then
No?
he or she will be named. They're already named. It's the school named. The
Right.
candidate
Candidate
should have
shall have-
contributed to the school.
I think that I'm still scrolling. Hold on.
The candidate should
school.
have contributed to the school that is named after them.
Yeah, or the
There you
school/facility
go.
facility that shall bear his or her name.
That's
There you go. That's good too.
That's better. Yeah.
Yeah, that's good.
I
Did
like
you
this.
hear what he said, Jessica? Or somebody said, I don't know who said.
I'm trying.
The candidate should have
Trying to write as
contributed
everyone speaks.
to the school/facility. Joel, what?
You could say, well, what the heck did I say? Oh, you could say
Said that will bear their name.
No, Sandy
Yeah.
said it.
Yeah.
You can either say that will bear their name, that's what Joel
Yeah.
said, or the candidate should have contributed to the school/facility that will be named after them.
for whom it is
Yes.
being named after.
General buildings.
I,
I
well,
like
As a
the
person that should
other
be.
one. You don't want to end with, you don't, Sandy, repeat what you said.
Who?
Sandy.
I said the candidate should have contributed to the school/facility that will be named after them.
Yes. Yes. No? Yeah, that will be named after them.
For the school
Because you're saying the
/facility that
school's
shall
being
bear.
named, not the person.
Not the person.
Yeah.
Facility
Sounds
that
like
shall
the
bear their
person's
name.
being named.
It does, that's what it sounds like, huh? Yeah.
The school/facility that shall bear their name.
That's fine, too.
Yeah, that's just, yeah. As long as we're talking about this, the building being named.
Listen, and at the bottom, put an asterisk that says, if you have a question, call Karen Olivera.
Yeah. Shut up, you. It just didn't sound right to me. But it sounded fine a month ago.
Sharon Corsi, do you have all that? Because I mean, I just scribbled out 3 things. Do you have that?
I do have it.
Thank goodness. Thank you. And if you didn't notice, my iPad just went down to the ground. Thank you.
Sorry.
Can we have a motion at this point?
Motion to approve.
Is there a second?
I second.
All in favor signify by saying aye.
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 Any opposed? There are none opposed. The next item is consider and vote to approve legal structure and system of governments. Second read. Any questions or comments?
I move to approve.
Is there a second to that motion?
I'll second.
Motion made and seconded. All in favor, please signify by saying aye.
Aye.
Aye. Any opposed?
I
Next
love the
item, number-
collaboration, guys. This is awesome.
Number 6, consider and vote to approve facilities inspections, second read.
Move to approve.
Is there a second?
I'll second that.
Motion made and seconded. All in favor, please signify by saying aye.
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 Any opposed?
Aye.
Now, on the next items, number 7 through, is that number 12 also related to the building, Mr. Montero?
Yes, sir. Yes, sir. Yeah, 7 through 12.
So it is. 7
Uh,
through 12, all related to the building, the new high school.
Correct, and which were
Is there
vetted and approved last night by the building committee. So if,
And any objection to voting on all those at once?
I do not, I would make that motion, Mr. Chairman, to approve item 7 through 12 as vetted and approved by the building committee, with Craig Enos having copies of all invoices.
I'll second
Is there a
that.
second? Motion made and seconded. If there are no further questions, items 7 through 12, all in favor signify by saying aye.
Aye.
Aye. And any opposed? The next 3 items, consider and vote to accept Mr. Ferrera's donation in toys to preschool and Mr. Ferrera's donation in printing for high school. Consider and vote to accept Mr. Ferrera's food donation to East Providence community during COVID-19. What is the committee's pleasure? Are there any questions or comments? Mr. Ferreira, do you have anything to say?
I have nothing at all to say, Charlie.
Okay, Tony.
If anybody has any questions, on it was printing for the high school. That was for when we had all the high school kids sign the board.
Yeah.
We put it all together and we had enough printed so each graduate gets one. We drop them off at the high school today. And if the school department can't pay to have a mail to each student, because that's the only way we can get them, then that would be on next month's agenda, because I would pay to have a mail to all the students as well. But they came out really good, so we'll try to get them so the public and you guys can see them. And then other than that, that was for the food donation that we did to start when COVID started. And the toys for the pre-K, it was just for all the buckets, pails, and toys when they had their little graduation for pre-K and moved on. That's what those 3 items are for.
Thank you for your exceptional generosity, Mr. Ferreira. Thank you. What is the committee's pleasure? Is there a motion? Mrs. Oliveira made a motion?
Oh.
I'll make a motion to approve.
I will second that motion. Did mine go through?
Yeah, I think he froze.
Am I frozen?
No, I think Charlie is.
Okay. Well, good. Then I can just say I hate that I have to do this part because I don't think I should have to approve how Tony spends his money. I say it every time. I'm going to say it again.
Thank you, Jess. I thank all of you for your vote.
And Ms. Beauchene made the second. We didn't take a vote on it yet, did we?
No, we did not. Waiting for you.
I take that thing back into after we vote. Go ahead.
Okay, all in favor, please signify by saying aye. Aye.
Aye.
Any opposed? And those are all the action items.
Thank you, guys.
Thank you, Tony. Any other announcements? Any announcements?
Mr. Chairman, I usually don't like to defend myself, but I think this week I kind of felt like Karen getting beat up on Facebook, but I got beat up at the police department and stuff by one of my candidates, which I'm perfectly fine with that. We all do what we do. The only thing that I'm asking, and I don't ask a lot of things, please come after me personally. Come after my business. Come after me personally. Please do not involve my family. That will take it to another level. And I am stating it publicly. Whoever wants to come after me personally or my business, I welcome it. They have the right to do it. We are all running for political office. When we go after my family, involving them, we're taking it to the next level. Not a very good level that people should be taking it to. That's all I have to say. I do not respond to these allegations on Facebook. I prefer not to get in front of them. The only thing I'm stating, when they were brought up the other morning that the police was involved, I copied it off of Facebook, contacted the police department. Full-blown lies. To bring the police department involved in me, and I go to the police department when I printed it off of Facebook, and they basically said, Mr. Ferreira, have no idea what you're talking about. Whatever is said on Facebook, we don't even entertain conversations. We are not looking for you. We have not been looking for you. So please go back to work and have a nice day. That's the level that it's at. But then when they bring in Bev and some other family members, I'm just asking, come after me. I welcome it all. I'm a big guy. Family members should always be off the table. Thank you.
Thank you. Any other announcements? Anybody else? If not, I'll entertain a motion to adjourn.
I make a motion to adjourn.
Thank you, Ms. Oliveira. Is there a second to that motion?
I second.
Motion made and seconded. All in favor signify by saying aye.
Aye.
Aye. Any opposed? If there's nothing else, meeting's adjourned. Thank you.
Stay safe, everybody.